Medicare Advantage plans can be extremely popular due to their all-inclusive approach to Medicare. However, there are definitely some downsides, and we have heard some major horror stories. So let's go over the top 3 Medicare Advantage nightmares as well as how to avoid them. If you're considering a Medicare Advantage plan, a reminder that we are licensed nationwide with no charge for our services, so you can reach us at the number on the screen, and you can also reach us in the comments below if you have any questions whatsoever. We are more than happy to help answer. Alright, so today we're going to be talking about those top 3 Medicare Advantage nightmares as well as how to avoid them. And if you've had a Medicare Advantage plan and it's either a success or a horror story, please let us know in the comments below. Now, in a way, Medicare Advantage plans will probably feel pretty similar because they function similarly to the group health insurance that you've had in the past in that there are networks. Now, the problem is if your doctor or specialist or hospital doesn't accept your plan and they're not in network, then you're going to be left without coverage. Now, this is actually far more common than you'd think. In fact, one of the most common complaints with Medicare Advantage plans is that people are unable to find providers who accept their plan. In fact, it's not uncommon to hear of people traveling an hour to find a specialist who accepts their plan. And if you do have a condition that requires a specialist's care, you certainly don't want to be limited in your options. Now, you can avoid this in one of 2 ways, one of which is to enroll in a PPO instead of an HMO.
So an HMO will provide you with in-network coverage only, which means if you can't find a doctor who accepts your plan, then you may need to travel or apply for a gap exception or pay out of pocket even. You'll also need a PCP with an HMO, and therefore a specialist is required for a referral. However, usually those premiums will be a little bit lower. Now, a PPO will give you more flexibility. You'll have in and out of network coverage. Of course, you don't have to have a primary care physician, nor do you need referrals to see a specialist, but usually those premiums will be a little bit higher.
And of course, we also recommend that if you do already have doctors and specialists and hospitals that you utilize, that you check with them in advance to make sure that they take your plan. Another huge nightmare issue with Medicare Advantage plans is the issue of
pre-authorization.
Now, Medicare Advantage plans are managed care plans, and that means that not only do you and your doctor have a say in your health care, but your insurance carrier does as well. And this is an issue with both HMOs and PPOs, so there really is no way of avoiding it with a Medicare Advantage plan. Basically, if your doctor orders a specific test or a treatment, then your insurance plan may need to first pre-approve that service or treatment before you can even make an appointment. Now, of course, this can cause huge and unwanted delays and headaches and hurdles. It can even cause you to be denied outright, which means you would have to pay out of pocket. So, first and foremost, when you're actually at your doctor's visit, make sure they know that you have a Medicare Advantage plan and that they will likely need to submit some type of letter or documentation to support that specific treatment or test that they're recommending. Don't wait until afterwards when you hear from your insurance carrier that it's denied or that you're unable to get an appointment. Also, make sure to call your plan immediately and find out how quick the turnaround time is for
Pre-authorization.
This is another reason we recommend working with a broker. Some insurance carriers are just better than others when it comes to pre-approvals. Now let's talk about one of the biggest and most common Medicare Advantage nightmares, which can be a nightmare with any type of health insurance plan, which is of course expenses. So if your doctor or hospital is out of network, expenses. If you can't get a pre-approval for a needed treatment or service, expenses. So please do your homework in advance. Also, remember to read your medical bills thoroughly. You would be shocked at how common medical billing errors are, and especially when we're talking about a Medicare Advantage plan, which is not so cut and dry as original Medicare or even original Medicare and a Medigap plan, it's much easier to miss those errors and end up significantly overpaying. Now, some additional expenses come in the forms of deductibles, copays and coinsurance, and out-of-pocket maximums. These vary plan by plan. Now, usually you'll have a deductible to meet. This is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share, at which point you would be responsible for a copay or a coinsurance. Usually a medical deductible is going to be rather negligible, but you may have a larger deductible if you need hospital care in an inpatient setting. There's also going to be an out-of-pocket maximum to cap your yearly medical spending, which is a great thing, and it's not offered by original Medicare alone. However, these deductibles and out-of-pocket maximums reset when your plan does. That means that if you have significant medical needs, you're going to again have to meet your deductible or even your out-of-pocket maximum every year when your plan resets. Now, these types of pitfalls can be overcome by enrolling in original Medicare with a Medicare supplement plan as opposed to a Medicare Advantage plan. Actually, all of the nightmares of Medicare Advantage can really be overcome by enrolling in original Medicare and a Medicare supplement plan as well. So make sure to check out our video that compares and contrasts Medigap with Medicare Advantage. They really are very different. As always, you can reach us at the number on the screen or in the comments below. And of course, a reminder, there is absolutely no charge for our services. Thank you so much and always have a wonderful day. Bye-bye.
Here's that video I just mentioned about the differences between Medicare Advantage and Medicare supplement plans. We'll see you next time.